Hi, welcome to the channel. In our previous video, we have discussed about stretches, why is it important, and the different kinds of stretches. In this video, we will be continuing to talk about PNF stretches and the MET stretches. PNF, proprioceptive neuromuscular facilitation stretches, is currently the fastest and effective way known to increase your static or passive flexibility. It is not really a type of stretching, but is a technique of combining passive stretching and an isometric contraction in order to achieve the maximum static flexibility. There are three different types of PNF stretches. The first is the hold relax. In this kind of stretch, the individual can perform passive 10 seconds pre-stretch and then hold it and resist the force applied by the patient, which causes an isometric contraction in the muscle group for 5 to 8 seconds. And then you relax the muscle group and allow a passive stretch. And after that, you have to hold it for at least 30 seconds to increase the range of motion. The next is the contract relax. The individual performs a passive 10 seconds stretch and the therapist applies resistance, counteracting the patient's force of a concentric contraction of the targeted muscle group without completely restricting the joint through its range of motion. Relax the muscle group and allow a passive stretch. Hold for 30 seconds and then increase the range of motion. The next stretch is the hold relax with agonist contraction. This technique is very similar to the hold relax technique, but it only differs in the final phase of the stretch. So you basically relax the muscle group and then you allow a passive stretch and then you concentrically contract the opposing muscle group of the targeted muscle that is being stretched to actively move the limb through the targeted range of motion and hold it for 30 seconds to increase your range of motion. There should be a greater stretch during the final phase. Now, let us talk about the muscle energy technique. The muscle energy technique or MET is another form of active assisted stretches, which is very similar to the PNF stretch. Like the PNF, MET uses an isometric contraction of the agonist prior to stretching. The difference is in this, the force of the isometric contraction in the MET are a lot lower. Now let's see how we can perform an MET stretch. The therapist moves the hip into flexion with the patient on their back until the therapist encounters a point of resistance where the movement becomes stiffer due to the tightness in the hamstring. Then the therapist holds this position for 15 to 20 seconds, then eases off slightly from the stretch and asks the patient to try to push the leg back down to the couch, which causes an isometric contraction of the hamstring. In MET, this contraction should be a maximum of 20% of the patients. To increase the range of motion, all the types of stretches are effective. Although the PNF type of stretchings may be a bit more effective for immediate gains. The dynamic stretches is recommended for warming up for athletes before competition or an activity. Post-exercise static stretching or your PNF stretching is recommended for reducing the muscle injury and increasing the joint range of motion.